Peterson, can you swallow for me, please? Perfect. And I'm going to check your hands. What I'm going to do right now is check what's called a capillary refill. So I'm just going to squeeze the tip of your nail right here and just watch your color come right back. So capillary refill is less than 3 seconds, so that's good. The next thing I'm going to be doing is listening to your lungs. So I'm going to start off, if you could kind of just scooch up a little bit and turn right towards me. So I'm going to start off in the anterior portion of your body, and then I'm going to do the posterior portion of your body. Okay, and I'll explain to you as I go. So if you could just pull your shirt up for me again, please. Hold it all the way up for me. So I'm also going to be doing a skin assessment at the same time. I can see here skin is worn, dry, and intact. Presence of a few moles on the right side. Other than that, no bruising or rash, no cause for concern. Have you had any problems with your moles, any bleeding or itching? Good. Okay. So when I'm listening to the lung sounds, I'm using what's called a Z pattern. I'm going to start right up here by the clavicle. So I'm going to start right here. Take a deep breath for me. And then I'm going to move over to the other side, and same thing, take a deep breath. Okay. And that's where you can hear the tracheal and bronchial sounds. I'm going to move down, and this is the left lobe. You can go ahead and take a breath. Deep breath. Good. And on to the right lobe, deep breath. Okay. And deep breath again. And now we're into the bronchovesicular sections. And you can go ahead and take a deep breath. And again. Okay. And one more time right over here. Okay, good. So I'm also going to be listening to the back, basically listening to your lungs in the back of you as well. Okay, so I'm going to have you turn this way. And I'm going to be doing the same Z pattern, and I'll ask you to take a deep breath for me, okay? Go ahead and just kind of cross your arms for me. And that's going to open up your... There you go. All right, go ahead and take a deep breath for me. And again. And again. Deep breath. And again. And deep breath. And again. And again. And again. And I'm also going to listen right here, which is the mid-axillary line. The right lung has 3 lobes, and the left lung has 2. So you're able to listen to the right upper, the right middle, and the right lower lobe, and the left upper and left lower lobe. Okay, so you can go ahead and sit back. So I'm also just going to point out that Mr. Peterson's respiration rate is 18. And I'm also going to be doing an assessment of your abdomen, so that's going to be our next step of the assessment, okay? So what I'm going to have you do is just sit back and open up your chair for me, please. And you can go ahead and lay back. Okay, so what I'm going to have you do is just pull up your shirt right to here for me. Thank you. So the first thing that I'm going to be doing for the abdominal exam is I'm assessing the skin. I'm noting the skin is warm to touch. I already noted before there were some moles on the right side, and what I'm going to be doing first is I'm going to be auscultating, which is listening for bowel sounds before I'm palpating. So right now I'm just going to be listening to your belly, okay? So I'm going to be listening to the 4 quadrants, starting with the right lower quadrant. And then the right upper quadrant. Left upper quadrant. And left lower quadrant. Okay, so I did hear bowel sounds in all 4 quadrants. If I did not hear bowel sounds, then I would have to follow the 5-minute rule, which would mean to have to listen to each quadrant for 5 minutes at a time. And that would be to check to make sure that there was no possible sign of a paralytic ileus or any sign of impaction. So next what I'm going to do is assess your bladder. So what I'm going to have you do is I'm just going to shimmy your pants down a little bit right here. And I can see that the bladder is not distended, and I'm also going to palpate your bladder. So I'm just going to push a little bit, okay? Tell me if anything hurts. Does that hurt at all?
No.
Okay. So bladder is not distended. And you can go ahead and pull that down for me. And you can go ahead and sit back up. And have you had any problems urinating or using the bathroom at all?
No.
And how often do you have a bowel movement?
Once a day, if not twice.
Okay, good. Okay, Mr. Peterson, I'm going to ask you a few questions, and then I'm also going to give you some information for you to take home with you today, okay?
Okay.
And are you sexually active?
Yes.
And do you practice safe sex?
Yeah.
And do you know how to perform a self-testicular exam?
Mm-hmm.
Good. And do you feel safe at home?
Yes.
Good. And do you feel as though you have healthy relationships?
Yep.
Good. And do you feel as though you have a good support system?
Yeah, between my family and my church, definitely have enough support.
Good. So I'm going to give you some information here just on some safe sex practices, as well as some basically written guidelines on how to perform the self-testicular exam. Okay, so I'm going to give those to you. The patient's hearing and vision was intact. His behavior was appropriate for the situation. He showed the ability to follow directions in the assessment, as well as demonstrated appropriate assessment for his developmental level. And he also showed his decision-making abilities, and the patient has also been compliant with care. And special thanks to my brother Jason, who videotaped my movie, and my husband Chris, who was our patient of the day.